Let's bring in my good friend, Dr. Joe Congini, right now. Sports Medicine Center, Akron Children's Hospital. And Joe, two huge wrestling tournaments in the region this weekend. And you wanted to talk about those grapplers on the mat.
Yeah, I did want to talk about the old term. You and I would remember those terms, the grapplers, the wrestlers, the hard work kids in those hot weight rooms. And it's kind of good to see. Remember, in 2020, we really had a lot of the season, most of it wiped out, and even some of the tournaments have skipped a couple of years. So it's great to see them back. I know the Deets is one of the big tournaments this weekend. And a lot of different things that go on with wrestling. But I got my first two calls of the year this week about a condition that really surprises a lot of parents. They don't understand it or see it that much going through this the first time. It's a thing called cauliflower ear. And we have to have a fancy name, of course, always. It's called auricular hematoma. And the auricular area is the area around the ear, and the hematoma means blood collection. And so what happens when kids are wrestling, when they get elbowed or kneed in the ear, or they rub forcefully against the mat, the friction from the mat will cause there to be bleeding in a space that's between the two areas of soft tissue and skin around the cartilage that is what makes up the ear. And so usually it's at the top of the ear, sometimes in the middle of the ear. When you look at wrestlers that were from our age or even in their 40s and 50s, when you see some of them around, they have kind of a rolled up area in the ear, and people wonder, hey, geez, what might that be from? You can be pretty sure bet that they were wrestlers in their day. So what happens is after the first two or three weeks, it's fluid filled, and the fluid is usually mainly blood, but sometimes it's kind of an orangish inflammatory serous fluid, we call it, that's in there, and it may be the size of a pea. It could be up to the size of, say, a quarter. These are pretty big collection of blood, and in the first couple of weeks, they're really easily treatable with an aspiration. In other words, using a needle to take that fluid out. It's pretty easy to do that, but the problem is, if we don't put something on compression, this is the biggest mistake people make, to compress it afterwards, the fluid will return, maybe 50% of it, 75%, but people don't like the way that looks after time. So you want to have to put something to compress it. The most recent is a button technique, or sew a button in the inside and outside to tighten that area up and not let that fluid come back. But if you don't do anything about it, at about 3 to 6 weeks, it becomes kind of rubbery, and you can't drain it anymore with a needle. And we do see that condition. And some kids in this day and age really do not like that. And at the end of the season, we use in some clinics, it's an ENT. In our clinic, it's our plastic surgeons can actually remove that dried up blood, that's kind of rubbery feeling. And but that's a little bit bigger. They have to make a small incision and take that out. So we don't want to have to go to surgery on these things. So what do we do? You know, in our world, prevention is always the big key. Prevention. And what we came up with 20 years ago, really well-fitted headgear that have the ear pads over the pad over the ear, and they fit nicely right over the ear. They virtually eliminate this thing. When kids are wearing their headgear, they almost never get cauliflower ear anymore. But when they're practicing for an hour or two, kids, this is what the athletic trainers of ours at the schools tell me, they get tired of wearing the headgear for the whole practice, and they take the headgear off when they're scrimmaging or practicing, or some don't wear it at practice at all. And I'm here to tell you today, gosh, it's a nuisance of a problem. It's a cosmetic problem. It doesn't look great, and it's a medical issue that we can totally avoid if you wear your headgear while you're wrestling in matches, while you're practicing, while you're competing. Make sure you're wearing the headgear. If not, when you get this problem, like the couple calls I got this week, get in early for drainage in the first 3 weeks or so. That's the easiest to drain it. There is very little risk of infection with drainage, of course, but early on we can drain it And then remember, though, something to compress it after, because it's bad to go in there, get it done, numbed up, take the fluid out, or just take the fluid out, and then 5 days later, a lot of the fluid comes back. That's frustrating. So the person you see must know about treating cauliflower ear and know how to use some sort of compression technique for at least a week so that fluid doesn't come back.
Yeah, good stuff. Good, Joe, back in our day, back in the 70s, very few wrestlers wore the headgear, and it was a major problem. I remember some of my friends who were wrestlers would really have problems with those ears going forward in life, as a matter of fact.
Yeah, I mean, it was 5 to 10% of guys. I mean, 5 to 10 kids on every team, and so it was really a big problem. We might have 5 in a day at the Sports Medicine Center. When I started, still even in the 80s, there would be more cauliflower ear. And if you look around, there's even a couple prominent politicians and others who you might know who still, you can see their ear looks rolled up a little and a little funny, and so there's still some remnants of cauliflower ear around, but it's preventable now, like a lot of things. Wear the headgear, and that's my strongest recommendation for wrestlers and their coaches and parents.
Perfect, Joe. Thank you, my friend. By the way, congratulations. Another congenie in the family. It's another grandchild born early this morning, huh?
Yes. Her name Alana Kane, 3:30, middle of the night, a month early. She came to surprise us last night, and so we're blessed, and thank you very much, Ray.
You're welcome, my friend. Have a great day. I know you will. We'll reconnect next week.
Sounds good.
All right.
See you later, Ray.
You got it. My good friend, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital with us.